Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself. Welcome back to the Beauty Equation. I'm Dr. Christelle Oliver-Dussault.
I'm Dr. Harpreet Lotay.
And I'm Amanda Manholt.
So today we're going to shift gears and talk about lasers, something that I think scares a lot of people and a field that I actually don't know that much about. And to kick it off, I'm going to get Harpreet to share a story of how she first encountered lasers and how that spurred her on to learn more about their use and their safety. So I'll let you take it away, Harpreet.
For sure. I mean, lasers are such an integral part of our aesthetic toolbox, but they are a bit of a mystery box. A lot of people think they're a magic wand, something that will magically make something disappear or instantly correct issues, and they don't really understand the intricacies of it. And to be frank, when I first started learning about lasers or got into aesthetics, I didn't know much about them either and didn't understand how they interacted with tissue, and specifically didn't have a great understanding about how lasers will treat melanated skin differently than less melanated skin. So the amount of pigment in your skin will actually determine much of the effect of the lasers. And so when I started doing Botox and getting interested in aesthetic medicine, I was with an oculoplastic surgeon in his office. Botox was a new thing. It was very exciting. They just come out with fillers. And then this new device called IPL was on the market. And it was this magic box that would amazingly clear pigment and take away reds, and it could even reduce hair. And I was working with a technician who was very fair-skinned and very adept at using the laser, but neither of us understood the intricacies of it. And one evening, as we do in aesthetics, we're like, oh, I want to try that. And I'm like, I want to try that. I have this one little brown spot by my cheek. Let's do my entire face. And so away we go. And she put in a filter for this flash lamp that really should be used for Scandinavian skin. And away we went.
Amanda.
Yes. Amanda, this would have been a great treatment for you.
I'm sorry that I missed it.
Yeah. Well, this was a while ago. This would have been about 24 years ago. So
Wow.
she, fired up the IPL machine, which is
Fire
not
up
a
the
true
laser.
laser. And we're going to fire up the almost laser. IPLs are not quite lasers, and we'll get into that. But she fired this up, stuck in a filter that would have been perfect for her skin type, and fired away. And I'm a bit of a stoic, and I've never had this treatment done. I don't know if it's supposed to hurt or not. And it was spicy. Let's just put it that way. And, we're done the treatment, and she's like, oh, you look a bit red. There's a few squares. Oh, they're getting a bit welty.
Oh,
Essentially,
no.
I burnt my face, ladies. Burnt it. Squares all over my face, scabbed over, and across my forehead. The entire forehead was burnt. And I had to,
No.
I actually wore like a scarf across my forehead while this healed up, because it was essentially like a second-degree burn.
Wow. Did you scar from it at all?
So it took a good year for the scars to
Wow.
somewhat fade. And I will share with you that even to this day, that I have a few very light squares that in the summer will become a little bit more pigmented than the other areas. So
I've seen them.
yeah,
I've seen them in the summer because I was like, wait a minute. Oh, there they are. It's fair.
Yeah.
Like it's very light, but if you look for
Yeah.
it, you can still
Hmm.
see it.
Yeah. So light-based treatments can be extremely powerful. And with that
Hmm.
experience, having seen how well it had worked for my friend who was a different skin type to me, and then experiencing how devastating this can be to somebody because, then you're kind of trying to cover it up with makeup and
Hmm.
whatnot and, having to use topical creams, etc. Um, it really made me determined to learn a lot more about the technology and how to use
Hmm.
these powerful instruments very safely. So that's really what spurred my interest into this whole field of energy.
Nice. Yeah, I feel like my understanding is still very basic because, again, it's not something that you're exposed to. And I even know, like, I have colleagues who are, you know, dermatologically trained and they wouldn't necessarily even have the laser training. It's some dermatologists will even go on to do a subspecialty, like a fellowship training in lasers. So where I'm at, and I'd say probably a lot of people would understand this degree, is that lasers are essentially a light-based device. And if you look at the color spectrum on lights, different wavelengths will, you know, pick up different colors. So reds for vascular lesions and maybe browns for brown spots. But if there isn't that contrast, particularly for more pigmented skin, you need quite a different approach or much more precise beam. And so when you were learning about it, what did you find helpful to, I suppose, learn the subtle differences? Because IPLs, I think, are that magic one where it covers quite a lot, but it's not very
Yeah.
specific. And with that, you can have a lot of sort of adverse events in the wrong patient.
Yeah, absolutely.
And more importantly, in the wrong hands.
Yeah.
Yes, exactly. Exactly. And then, your expectations have to match too. So there's a lot of misconceptions about lasers. Like I mentioned, it's sort of thought of as a magic wand. So oftentimes patients also think that it's a one and done treatment, and that's not
Hmm.
often the case. So, lasers are, I like to say, in some cases, it's like a fancy scalpel. So, depending on the target that the laser is focused on, it can use to cut the skin.
Hmm.
And then, depending on how you tune the energy up or down or the strength of it, it can be something that warms the skin.
Hmm.
And if you're using a particular wavelength, it will blow up certain chromophores, we want to call them parts of the skin, right? So pigment
Hmm.
cells, for example, or pigment bits in your skin often act like a magnet for certain
Hmm.
colors of laser. I like to explain to people that a laser, if you look at the whole rainbow, there are those colors, like you mentioned.
Hmm.
Each of those colors vibrate at a different frequency. And that's what creates that color. And so when you learn about lasers, you learn about wavelength. So you'll hear people talk about a 450 wavelength or a 550 or
Hmm.
600 or 755 or 1064. And those numbers relate to how fast that vibration of the energy is. And it correlates to a color and it correlates to what it's magnetically attracted to. So if you have a
Hmm.
green laser, it'll be attracted to the complement, which is red, which is
Hmm.
blood. So which is going to be very good for treating blood vessels or rosacea. And then if
Hmm.
you have a higher wavelength, like a 1064 or a 10,000 hertz wavelength, like a CO2, that will be attracted to water in our skin.
Hmm.
And those lasers act like almost like scalpels, and they create heat and heat shock proteins, and they're delivering this controlled sort of injury to the skin that your skin will
Hmm.
heal from. So in my case, what happened is that we used a wavelength that was too short, and
Hmm.
that doesn't penetrate very deep. So interestingly, the number 400 to 1064 also correlates to how deep that energy will penetrate the skin. And
Hmm.
our pigment cells live close to the surface of our skin, and so those shorter wavelengths will actually hit those pigment cells. Sometimes by accident, the heat will affect them and you'll get burning. So that's what happened to me.
Mhm.
Um, so yeah, it's a tool like any other.
Mhm.
It's not a magic wand,
Mhm.
and it's extremely effective. Now, I had an issue, but that didn't stop me from getting other lasers done. I've had multiple halos, which is perfect for my
Mhm.
skin type. And in fact, lasers were one of the solutions for the injury that I suffered. So I don't want
Mhm.
people to be scared of them. They're actually extremely,
Yeah.
extremely useful.
I think it's fair to say, though, that if someone is interested in having a treatment, a laser treatment on their skin, because they're bothered by broken capillaries, hyperpigmentation, the typical brown spots, or they're looking at improving the texture, it is probably the most important thing to make sure that whoever they're seeking treatment with has a lot of experience and thinks critically.
Mhm.
I know we've talked all the time, frequently about IPL, BBL, so intense pulse light or broadband light,
Hmm.
being so dependent on whoever is delivering the treatment. And,
Mhm.
I think it's kind of scary because if I understand correctly, it's not that if you can get your hands on a laser, you can hang a shingle and say you're open for business where we live. I don't know that there it's kind of the Wild West in terms of um, you know, what's out there. So kind of buyer beware. I still love it.
Mhm.
Experience is everything. Um,
Everything.
Mhm.
your point about regulation is right on point. So, um, let's just touch on IPL, for example. It's kind of the difference between having a a shotgun, which is what an IPL is,
Mhm.
versus a very precise sniper weapon. Let's just call it that way, right?
That's a really good analogy.
Yeah. And this shotgun, you don't need a license for in Canada. You
Mhm.
can just get it. And I've
Mhm.
heard of instances where people have bought an IPL and then have been treating people in their home. And it's a
Mm.
very, very powerful machine. And so if you imagine that shotgun, you can put filters in front of the buckshot so that you can focus the target a little bit.
Mhm.
But if you use the wrong filter on the wrong person, you're going to end up shooting the wrong thing in their skin, whether it be
Yeah.
pigment or, get too much heat.
Mhm.
Um, and so you do want to really be sure that the person you're seeing is a professional and they can handle, adverse outcomes too. So they know what to do if your skin doesn't respond like they expect.
Mhm.
Yeah. And I think the difference between a a good practitioner and a really great practitioner is being able to gauge that response in the skin and know that those base settings, they're typically safe as long as you
Mhm.
fit the skin type parameters. But on the other side of that is if they can push it a little bit, wow, like some of the results are just mind blowing. So it's that sort of sweet spot between they need to be cautious and responsible, but sometimes when it's appropriate, they can amp it up a little bit and get some pretty amazing results.
Yeah, it's like trying to drive a Ferrari, right?
Yeah.
You
Mhm.
want an experienced driver.
So we've talked a little bit about light based treatments, which again, people tend to use the term laser, even though technically, if we want to nerd out, they're not lasers, they're light based treatments. Let's talk a little bit about the other kinds of treatments that truly are lasers. So things that are slightly or completely ablative.
Yeah, when we use the word ablative, that means destruction, tissue destruction in a controlled way.
Mhm.
That means that the top layer of the skin is going to be affected and sloughed off or sandpapered off. Okay. When we're talking about non-ablative, it means that the energy is delivered below the skin. Remember, I said that the wavelengths determine where the energy is delivered. So the longer
Mhm,
wavelengths, you can actually just deliver the energy down deep. And if you tune it up
mhm,
high power, the heat will actually affect the top of the skin, and you'll drill a little hole.
mhm,
And those ablative lasers can be fully ablative, which is like take sandpaper, rub it across the skin, and you're really rubbing a layer of skin off.
mhm,
Or it can be like aerating your skin, which would be what we call fractional
mhm,
lasers and fractionally ablative. So these are all terms that we use, especially for resurfacing lasers. And when I use that word, I mean things that you're doing to help with fine lines and wrinkles and usually
mhm,
create collagen at the same time.
mhm.
Mhm.
So along with your topical skincare, lasers are a great tool to really stimulate your skin to create more collagen. That's essentially what we're doing, but we're doing it more rapidly and a little bit more assertively in a controlled way.
I think it's another or I think another good point to mention is the seasonality that comes with lasers.
Mhm.
And why in some parts of the world people will be doing, IPLs, BBLs, halos of these sort of things maybe year round.
Hmm.
Where we live, we tend to shy away from that. And we, tend to do these treatments in the cooler months and when there's less sunshine. I mean, right now
Yeah,
I feel like I haven't seen the sunshine and I don't know when.
yeah.
As we approach the winter equinox,
I know. I can't wait for it to start getting longer days, I tell you.
you
Yeah,
go to
so
work in the dark and you come home in the dark.
I
You know what it
know.
is? It's laser season in Canada, folks.
It's yeah, fire them up, folks. That's true. So why is there seasonality in the northern hemisphere or places where we have four seasons? I like to explain it this way. The melanocytes or the pigment producing cells are very, very sensitive to laser. And when we're in the summer, we're stimulating our skin with sun exposure to create pigment. And those melanocytes are like little minions. They get kind of hyperactive and they start
Mhm.
spitting out pigment in a very unpredictable way. And you might go out to the lake one week, a couple days in that week, and have be quite tanned, and then go for a few days where you have lots of work, you don't get out to the lake, and your tan fades a little bit. So your baseline melanin is unpredictable. So when
Mhm.
you go in to see your laser tech, sometimes it's very difficult to tell what laser setting should be used. And also, the settings that were used last time are going to work this time. And so it's hard to give you an aggressive enough treatment in the summer months safely to get you
Mhm,
the results you want. So in our clinic, we do choose to shut down our lasers in the summer so that in the winter, we know you've got generally a baseline color that's not going to vary too much. It allows us
mhm,
to kind of tune in our settings and be as aggressive as we want. We also know that skin that has been lasered is very sensitive to light. So if you have laser done and your skin is recovering, you've got all this metabolic activity of skin cell production, and your melanocytes are a little bit more irritable as well. And then you go out into the sun, you get unpredictable results there as well. And you will get bronzing and you will get hyperpigmentation that can be temporary. There are some places like in California and where the sun is fairly consistent. And
mhm.
in those places, every season is laser season because most people have a very consistent sun exposure.
Yeah, I'm
Mhm.
moving
And
to San
so,
Diego,
yeah, I know
right?
it would be great. Would be
If
great.
someone does want to get a laser treatment done, what would be the best way for them to prepare for their treatment?
Well, like so many aesthetic treatments, I think that people have to remember that it's your skin doing all the work.
Mhm.
And again, people think it's magic and the laser is doing all the work. And the truth is, it's not. All it's doing is stimulating your skin. So if you have a collagen inducing, resurfacing type laser, it's almost like aerating your lawn. You're drilling holes into the skin and you're delivering some energy and you're stimulating a response. And if we follow that logic, the healthier your skin is, the better the response will be to that stimulus. So, one of the
Hmm.
best things that you can do before you have laser is start yourself on a really good medical skincare regime.
Hmm.
If you are highly melanated like myself and you tend to hyperpigment, you might want to start on something that decreases the hyperactivity of your little melanocyte minions. Some people will pre-treat with hydroquinone
Hmm.
or something like kojic acid. If they're not interested in hydroquinone containing creams, those are some things that you can do. And of course, your baseline health is going to impact your skin's
Hmm.
recovery. So, sleeping well, drinking water, eating well, all those boring things that we wish pills could fix.
Of
Right?
course.
Or a milkshake.
And then what
Yeah.
about aftercare in terms of recovery, particularly if we're focusing on those fractionated ablative lasers that will have a bit more downtime? How can patients care for their skin?
So, if we're talking about very ablative lasers, you really want to be gentle with your skin. So you're going to stop all of your retinol containing skincare, all of that harsh skincare. And you'll know
Hmm.
that you've had an ablative laser because you'll have scabbing and it will be
Hmm.
open skin. So
Hmm.
those types of lasers can take up to a month to heal from. But to be honest, we do very few of those now. There's very few
Hmm.
patients that need that type of aggressive laser. And
Hmm.
in fact, people have told me when I mention laser, especially those patients that are in their late 50s or 60s, they're like, "Oh, I don't want laser because my friend had it and her skin looked sort of plasticky or something afterwards." Those
Hmm.
results we used to see in old-timey, old-fashioned type of lasers, which were fully
Hmm.
ablative and sometimes
Hmm.
they'd go too deep. We don't do
Hmm.
those kinds of lasers very often anymore. We tend to do fractionated ablative lasers, and
Hmm.
those are much easier to recover from. One of the lasers that falls into that category would be halo laser,
Hmm.
and that's about a 10-day downtime total
Hmm.
from treatment to really nice glowy skin.
Hmm.
And again, the care for that is going to be very gentle skincare, especially for the first 3 or 4 days. Then you can gradually bring back some less active skincare into the regimen. And
Hmm.
then going on to 7 to 10 days, you can reintroduce most things, maybe hold back on the retinol for about another week to 3 weeks. And that's going to depend on your skin's sensitivity and how used to retinol it was before you had the laser.
Hmm.
And then
And
sunscreen.
always
Yeah,
sunscreen,
let's
but
yeah,
that's just a given. But we'll talk about it
yeah.
every
Well,
single time we
yeah.
talk to you.
Yes.
I think one last thing to maybe mention briefly is discomfort, because that is a question
Mhm.
I get a lot in consult. Like, well, does it hurt? And the word we like to use is spicy.
Spicy. Yeah,
And
well,
I love BBL. I am like the poster child for BBL because I'm, Fitzpatrick 1, Scandinavian
mhm.
skin, prone
Yeah.
to redness,
Hmm.
um, broken capillaries. And I hate having it done, and I love the results. To me, it feels like an
Mhm.
elastic. It's like snap, snap, snap the whole time. Because of course we don't numb for that one.
No.
It's more annoying, I think, and it's the flash. There'll be eye shields on, but
Hmm.
it's still quite bright. It's just sort of a little jarring. But
Yeah.
truth be told, as soon as, the foot's off the pedal, there's nothing. You look
Hmm.
a bit red, that when I look like a tomato when I leave, but by the next day, I'm fine. Um, and then the other treatments like that we do in our clinic would be the halo,
Hmm.
which, to be honest, a BBL halo combo is like chef's kiss. It is my
It is.
favorite for people that are looking to do a general refresh. They've got sun damage. Oh, it's so good. We just
Yeah.
did had some really amazing results, and I'm really hopeful that that woman will give permission to share the before and afters, because even the improvement in those, like, the lines here, these sort of lines that,
Accordion
are
lines on the
accordion
sides of
lines
the
sort of,
cheeks.
yeah,
Yeah.
under the cheek, between, below the cheek and,
Yeah.
away from the mouth, they were so greatly improved.
Yeah.
And so for a treatment like that, the for the halo portion, we will apply a topical lidocaine for an
Mhm.
hour prior. So it makes it more comfortable. I don't know. You guys have both done halo, right?
I have. Have you
I had
done one,
not.
Christelle?
No,
Oh,
I'm
we have
planning.
to
So
get
I'm
you
one of
doing it.
those who's so I had melasma with my pregnancies. So I'm
Hmm.
currently doing the hydroquinone, so the pre-treating that Harpreet was talking about to get rid of the last
Yeah.
little bits of hyperpigmentation before I schedule the halo. And I'm also
Yeah.
prone to
Perfect.
hyperpigmentation. So I might look like I'm semi-fair right now, but I have kind
Yeah.
of, I would say, type 3, 4. I
Yeah.
will tan very easily. I hyperpigment and I had melasma. So one of those that sometimes are the ones that I think will run into trouble because you won't necessarily think that when you're going into a place to get, say, like an IPL, and then you'll end up
Yes.
with that hyperpigmentation. So I suppose
Yes.
I have a sort of laser story in the sense that when I was getting laser hair removal, I had a lot of I had a bit of a mustache. I ended up with hyperpigmentation on my upper lip
Mhm.
afterwards, which took a very long time to go away. And even though I did it in the winter months, wore my sunscreen, this was well over a decade ago, I still ended up with a bit of hyperpigmentation, which got worse when I was pregnant, because that's hormonally driven. But um, yeah, so
Yeah.
hydroquinone.
Which all
I'll let you
Yeah.
guys know maybe in a few months' time once I have
Oh,
the
let's
treatment
Yeah.
do it.
when
Let's do it.
I'll let
But
Good. So
this
I,
brings my point home about who is doing this treatment, because
Mhm.
if you go somewhere to have a laser treatment, you best be getting lots of questions asked of you.
yes. Yes.
Mhm.
It is so very important that they ask you things like, how do your skin respond when you get a mosquito bite? Are you
Mhm.
prone, do you know your ethnic heritage? Because you can
Mhm.
have somebody with dark skin, maybe you have one grandparent that had very highly melanated skin, and you don't maybe look like you're that dark, but I tell you, it can bite you. So I think
Can.
it's important to
Mhm.
go to a provider that you feel
Mhm.
is asking all of the right questions.
Yeah.
For
And I had this
sure.
done in my early 20s. I wasn't asking the questions either. I didn't really know what I was doing. I just wanted to get rid of the hair.
and 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 that's the thing. You shouldn't have to know to
Mhm.
ask the questions, right?
Just
So
yeah.
let's just circle back to Fitzpatrick types, because we've mentioned it a
Mhm.
few times, but many of our listeners
Right.
might not know what that
Mhm.
is. So the Fitzpatrick classification is a way to classify skin based on its tendencies to take on color.
Mhm.
Mhm.
And it classifies it on the way it heals and expected healing in response to energy, let's just say. And
Mhm.
so if you can imagine somebody with blue eyes, very light hair, and very pale skin, that would be a type
Amanda.
1, Amanda. And then you might have someone with uh, light hair, slightly darker eyes. They tend to tan, but it's still a bit hard to tan. They don't hyperpigment. They might be a type 2, and then type 3 would be darker hair, darker eyes. They take on color reasonably easily. They will burn sometimes,
Mhm.
and they may or may not hyperpigment in response to a bug bite or a cut or something like that. And
Mhm.
then type 4 would be, typical Latin or Mediterranean skin
Mhm.
types, some
Me.
Asian skin
Yeah.
types. Right.
French
And,
Canadian, that sort of
right.
olive Eastern European
Yes. All of
often.
these skin tones.
Yeah.
Then going up to 5, which would be some African skin tones,
Mhm.
depending on the region, and some South Asian, Indian
Mhm.
skin types. And then 6 is your darkest dark. And
Mhm.
one other fallacy that I think a myth, I would say, or belief that people have is that darker skin types are somehow tougher.
No.
And it's the exact opposite,
Yeah,
right? And
totally.
that it's the exact opposite. So the
Mhm,
type 1 skin type, you can do almost anything to it and get away with it. It's the toughest.
mhm. Trust me, we've
Um,
done a lot of it to me.
yes. And then your type 6 skin types, rub it the wrong way or throw too much energy
Mhm.
at it, it will hyperpigment. It's extremely
Yeah,
delicate,
yeah,
sensitive
yeah.
to different topical medications, even.
Mhm,
I've seen hyperpigmentation in response to going too high on retinols too
mhm.
fast. So they really are a more delicate skin type for
Yeah.
sure.
And I think we think that it's stronger, more protective because you think, oh, they're really good at making melanin and protecting themselves from the sun, but almost they get too good at it, so it doesn't take much for them to make that, and that's why you run into troubles.
Yes,
I always thought it was wild that, when we look at my skin and we look at your skin, for example, that the number of melanocytes, so the little cells that produce melanin or pigment, can be very similar in numbers. It's just mine are like Garfield. They're snoozing. They don't they don't party. They're very
they just don't
lazy.
make as much pigment. Yes.
Yeah,
Mhm.
and somebody that has a darker skin, they're ready to boogie down. And then
Mm-hmm.
there's, if we that's a whole other podcast, but I mean there's different types of melanin, right?
Mhm.
Mm-hmm.
And I don't have a lot of the type that protects my skin.
Mhm.
Yes.
So, oh gosh, we're at 32
Yeah.
minutes.
Yes.
The
So
topic
yeah.
that
So
we could spend hours
when
talking
you're
about. There's so much, but I think this has
what's
been a
that?
really, really good. There's just so many subtleties and different types of light-based and laser treatments, but I think it's a very good introduction to understand how
It
useful it
is.
is, but how harmful it can also be in their own hands.
Yeah, so
Yes.
know where you're going, know what you're trying to improve, right?
Mhm.
Is
Mhm.
and I think sometimes people want to say, "Oh, well, it's everything. I want invisible pores, and I don't want any color, and I don't want this, and I don't want that." And I think um, it's about learning to assess someone and sort of think, okay, what would be the most impactful improvement for this person?
Mhm.
Is it the right time of year? So sometimes we have to sort of go, okay, yeah, I mean, BBL Halo would be, oh, bomb, but it's July. So what can we do now to sort of get them ready for that next step?
Mhm.
It's a lot of fun, coming up
And I
with the
think
right
as
treatment plan.
it is, and a takeaway for people out there who are looking for lasers, to your point, Amanda, have a sense of what you want to improve first. Know that every
Mhm.
laser is not going to treat every problem.
Mhm.
Know that it might be more than one session. And if it is more than one session, maybe that's a good thing because that's
Mhm.
probably not going to be a heavy handed laser that has a lot of downtime. So
Mhm.
sometimes choosing more sessions is a better choice. And
Mhm.
when you're going in there, your provider should be asking you many more questions than maybe you are asking them.
Yeah.
Yes, exactly.
So, on that note, if you have questions on today's episode, or you would like us to go in more depth into one area, or you've had a treatment and you want feedback, get in touch with us and we will try to cover it in future episodes.
And don't, I don't know, I'm going to say, and please remember to like and subscribe to our podcast.
Absolutely.
Until next time.
Bye for now.
Bye for now. Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the beauty equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on The Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at H. Lotay MD, and at Crow's Feet and Confidence. Until next time, keep questioning the equation.